Welcome. My name is Carrie Winterdahl, and I'm the Digital Health Literacy Coordinator for Eastern Illinois University, representing Booth Library, the Department of Public Health and Nutrition, and the School of Communication and Journalism. Today's digital health literacy topic is choosing a doctor that is right for you, taking an active role in healthcare. Thank you for joining us today. It is important to take an active role in your healthcare to get the highest quality of care you want and need. That means good communication with your doctor is key. You need to find a doctor you feel comfortable talking with by asking questions when you do not understand instructions, talking about problems even when the doctor doesn't ask, mentioning concerns about changes in your daily life, or needing clarification of a treatment. All healthcare providers have different communication styles, and you have the power to choose the doctor who is right for you. A primary care doctor, or PCP, takes care of routine healthcare needs. Primary care doctors manage preventative care with things like physical exams, immunizations, and routine health screenings. They also diagnose and treat chronic conditions like high blood pressure and type 2 diabetes. It is important to have a primary care provider because they act as your home base. They not only manage and treat your short and long-term illness, but they are your guide to the healthcare system as a whole. There are several types of primary care providers who focus on different patient needs and health conditions. A pediatrician has a health focus of infants, children, adolescents, and young adults. Pediatricians see patients from birth to 21 years of age. They use preventative care and manage physical, behavioral, and developmental issues concerning children. Doctors in family medicine perform the same functions, but they treat patients from birth to death. Adult or internal medical doctors work with people ages 18 years and older and have general knowledge about all medical conditions and preventative care. Geriatric doctors specialize in managing care for older adults, usually 65 years and older, who may also have complex health needs. Many doctors have highly trained people working alongside of them in their practice. The physician assistant, or PA, and the advanced practice nurse, or APN, work under the direct supervision of the doctor and may be available to you as well. They are able to perform many of the same services the primary doctor does and may have the ability to see you if your doctor has a full schedule. When looking for a primary care provider, you can ask if they have PAs and APNs working for them as well. When looking for a doctor, you may see MD or DO behind their name. These letters represent the doctor's credentials and how they practice medicine. Both MDs and DOs practice medicine backed by science and research and take advantage of the latest medical advancements, but the difference is that DO has been trained in an alternative or non-traditional medical treatments like bone and muscle manipulation techniques. After deciding what type of doctor you want, make a list of qualities that matter most to you. Is the gender of your doctor important? Do you need a doctor who is available in the evening or on weekends? Do you want a doctor who is associated with a particular hospital? Do you need a doctor who speaks a language other than English? Do you want a doctor who is in an individual practice or is part of a group? If you have health insurance and belong to a managed care plan like an HMO or PPO, you may need to pick a doctor that is within your plan's network. Their health insurance company may offer you with information about doctors in your network as well as their background and credentials. You can call your company and ask for a listing of network providers. Many companies have websites with lists of doctors to choose from, and you can call customer service and they can verify that information for you. It is very important to make sure the doctor and healthcare facilities you choose are in network with your health insurance company, or you will be responsible for paying the entire medical bill. Once you have a list of names, ask friends, relatives, medical specialists, and other health professionals for their opinions. If they know the provider, ask questions like, "What do you like about Dr. Smith?" And "Does this doctor take time to answer your questions?" You can also ask them who they see and why they like them. A doctor whose name comes up often may be a strong possibility. You can also gather information about the doctor on the internet. Some great places to look for information about the doctors on your list or get names of other doctors are the Medicare.gov Physician Compare Tool, the American Medical Association's Doctors Finder website, the American Board of Medical Specialties Certification Matters database, and Medline Plus has a comprehensive list of directories. These websites don't recommend individual doctors, but they do provide a list of doctors in your area. What does board certified mean? To be board certified, doctors have extra training after medical school and are required to pass an exam that certifies they are experts in certain areas. All board certified doctors can be found on the American Board of Medical Specialists website, or you can call 1-866-275-2267. This is a great way to learn about what areas of expertise the doctors on your list have. When you have shortened your list to 2 or 3 doctors, it is time to call their offices and ask some questions. You can ask the staff questions about how busy their office is, how they schedule, office policies, and payment procedures. When speaking with the office staff, pay close attention to how they talk to you. You'll have to talk with them often. Next, choose a doctor and make an appointment to meet and talk with them. You may have to pay for this first appointment, but this is a great way to see if they fit your personality and needs. If you do not feel good about your first choice, do the same for the other doctors on your list until you find one who is a perfect match. Some of the questions you can ask when interviewing the doctor are, what type of patients do you see? How do you feel about involving my family in my care decisions? Can I call or email you or your staff whenever I have questions? Do you charge for telephone or email time? What telehealth services do you offer? What are your thoughts about complementary or alternative treatments? Getting answers to your important questions will help you make the best choice of doctors. When deciding about which doctor to choose, you might want to ask yourself questions like, did the doctor give me a chance to ask my questions? Was the doctor really listening to me? Could I understand what the doctor was saying? Was I comfortable asking the doctor to clarify what they were telling me? Being comfortable talking and sharing with your doctor is very important to getting the best care possible. Once you've chosen a doctor, make your first actual care appointment. This first appointment is a great time to get to know the doctor and office staff as well as how they communicate. Introduce yourself and let them know by what name you prefer to be called. For example, "Hello, my name is Mrs. Smith." Or, "Good morning, my name is Bill Johnson. Please call me Bill." Learn how the office is run, which days of the week are busiest, and what are the best times to call. Ask what you should do if you need the doctor after the office is closed or if you have an emergency. Make sure you bring your medical records or they can be sent from your former doctor. Share any medical allergies you have. Bring a list of your current medications or put the medicines all in a bag and take them with you. Below you will find a link for a medication worksheet you can use to keep track of your medications to share with your doctor during each appointment. Taking an active role in your healthcare means finding a doctor that is right for you. The doctor needs to be someone who you can trust and feel comfortable having conversations with. You have the power to choose your doctor and the power to be the leader in your health journey. For more information of digital health literacy, check out more of our topics on the Eastern Illinois University Booth Library Guide site. Thank you.